Hi, my name is Tim from Hazelton Physical Therapy. We're here today to talk a little bit about knees and knee pain. It's one of the most common problems that we come across in the physical therapy clinic. And I just want to show you some things that you can do beyond exercising, which we do a lot in the clinic. But people don't realize that just exercise on its own may not be as effective as adding some of the other techniques that might be able to help with knee function. So the problem that we come across is that most people don't realize that arthroscopic surgeries of the knee for arthritis, which is done very routinely these days, has been found to be not as effective as people may like to think they are. So we get a lot of people come in after arthroscopic knee surgeries, still having difficulties in terms of pain and tightness in the knee, not being able to do what they want. So just to show you that in the most common case of knee problems that we come against, the problem with the knee is usually a muscle imbalance in the thigh muscles, or what we call the quadricep muscle, which I have my assistant here, Justin, who's going to demonstrate this for us. So I'm just going to roll his leg up. And the muscle imbalance with the quadricep muscle, which is the big thigh muscle, occurs when the outside of the muscle, including the IT band, which a lot of people know about, tends to get tight, and the inside of the muscle, what's known as the vastus medialis muscle, tends to get weak. What happens there is that imbalance will result in a misalignment of the pull of the patella, or the kneecap itself, which causes problems with tracking, which commonly causes pain in people. So typical pain that people will feel with this type of problem is on the inside of the knee, and even though there's no percentage as such in the research, but I would like to say that from my experience personally, up to about 70-80% of people will have this type of problem, even though they have arthritis moderate to severe in this knee. So what can you do beyond exercise is the question, because most of us know exercise. And the problem with just doing exercise is the knee has a concept called pain inhibition, which occurs. Pain inhibition means that when you have pain in the knee, it actually shuts down a muscle called the vastus medialis on the inside. And remembering that that muscle is weak anyway, it's going to make that muscle even weaker, cause more tightness on the outside, which will sort of make the exercise not as effective as possible and actually make things worse. So one of the things we do in the clinic is we work with people to try and loosen the outside tight muscles first, and try and facilitate or increase the activation of the inside vastus medialis muscles so that people can exercise. And when they do exercises without pain, it makes the exercises a lot more effective and can be quite beneficial in helping reduce pain. So some of the things that we do is use our hands to try and loosen up the vastus medialis. And Justin, being a fairly athletic type of guy, I think he mountain biked earlier this week, right, Justin?
Yeah.
And did a bit of running, so he has tightness on the outside. If you have a look at the outside of the muscle, it's mainly the outside half of the muscle is usually tight, and typically around the mid-thigh region, which is right here. So all you need to do at home, just let your leg relax, Justin, relax. All you need to do at home is poke around yourself a little bit in through that area right there. And you can feel the tightness and the pain as you work in there. So one thing to do is just work on that muscle maybe for about 5 to 10 minutes before you try and do an exercise program, and loosening that up can be extremely beneficial. And most people know of the IT band, which is the iliotibial band that runs out this way on the outside lateral aspect of the thigh. Working in that IT band can be very effective as well. For people that don't have access to a good physical therapist, they can use foam rollers most people are familiar with. They can use tennis balls, and we've even asked people to use rolling pins. If you could imagine getting a rolling pin and just rolling that muscle forwards and backwards, it can be very effective to loosen that muscle. So with Justin, imagine he's having knee pain. We would be in here working on this muscle for maybe like 10-15 minutes to try and sort of relax, to prepare the muscle to be looser for activity. The other thing that we do is we try and facilitate or improve the activity of the inner muscle called the vastus medialis. One of the most effective ways that we can do this is through taping. The taping method is called McConnell's taping, and what it involves is, if I can get Justin's leg up and just let your leg relax in my knee. What it involves is it stabilizes the kneecap so that these external or the lateral structures don't pull your kneecap externally when the quadricep contracts. And it just helps stabilize it and keeps it in line in terms of tracking when you're exercising. And it also helps give this vastus medialis an advantage in terms of when you are exercising, doing like squats and lunges and that type of thing. So McConnell's taping, I'll show you just a quick method to do it. There's different taping methods. You can also use kinesiology taping, but one of the most effective I've come across is McConnell's taping. So I'm just going to pop this tape on Justin's knee. This is just a hypoallergenic tape, or what we call cover roll stretch. And this is just to protect your skin if you're having this for a long period of time on your knee. Justin being pretty hairy, this actually might pull off some hairs when he takes it off. But he's tough, he knows, he can handle it. So that's just the cover to protect the skin. This is what we call leukotape. This is fairly strong athletic tape, and you can get it at medical supply stores. It's usually not readily available at department stores, but if you know a medical supply store, you can pop in and grab it from there. So basically what we do is we put this tape down. This is non-elastic, and we stabilize the kneecap and shift it across, and we put that tape down so it holds his kneecap that way. Okay, very simple piece of tape to put on. And we also put a second piece of tape on to help rotate or tilt the kneecap, so that again it gives that vastus medialis or inside quadricep muscle a bit of an advantage when it's working. There is more taping to it. You can rotate the muscle depending on the problem. You can tape the plica, or the little piece of fat that you've got down here, and all sorts of taping methods, but most cases we find in the clinic this is good enough in terms of helping muscle contractions. And the goal is to help ease the pain in the knee to the point where Justin or the person with knee pain can start doing exercises with less pain in the knee, because what happens then is that it allows the vastus medialis to strengthen, which is the key muscle that we need to strengthen when dealing with knee pain. So for the people out there who are dealing with knee pain, just let your leg relax. Remember, a lot of time that pain can be eased a lot by doing some activities beyond just exercise. And exercise can actually be a lot more effective if you work the muscles around the knee, around the ankle, around the buttocks even, to help loosen tightness. So next time you have problems with your knee, rather than get into an exercise program that's painful, look at doing some stuff to ease the pain first. And if you're not really sure what to do there, just check with your local physical therapist. They can be very effective at helping you deal with your knee pain.